We are ready.
So they're gonna hand out.
Welcome, everybody, to the Desert Health District Board meeting of May 26th. We're gonna go ahead and call this meeting to order at 4 p.m. Can we go ahead and get roll call?
Director Smith. Here. Director Rogers.
Here.
Director Perezville.
Here.
Director Logston. Secretary Delara.
Here.
Vice President Rodriguez, not with us today. President Barraza.
Here. Thank you. If you could please join me for the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next item C, approval of the agenda. Questions on that? amendment?
Madam President, I just wanted to make sure that cross our Ts and dot our Is. And I want to make sure that we add the closed session item pursuant to Government Code Section 54954.2 B2. And the board needs to provide some direction on that item. So I just need a for the board to go ahead and add that item.
You need a motion?
Yeah, please.
I'll move. To
Second.
approve.
Roll call?
Director Smith.
Yes.
Director Rogers.
Yes.
Director Perezville.
Yes.
Director Secretary Delara.
Yes.
President Barraza.
Yes.
Thank you.
Before you asked, I do have just as a note for F, there are action items, for F3. I need to recuse myself, sit on the board.
So item F.
Yeah.
Okay, I think you would just recuse yourself, right, when we come
Correct.
to that, item. Thank you.
Thank you.
Thank you for that. Alrighty, so do we have a motion to approve the agenda with closed session added to it?
I'll move to approve.
I'll second.
Okay, all those in favor?
Aye.
Seeing no opposition, we're gonna go ahead and move forward. Next item, D, public comment. At this time, comments from the audience may be made on items not listed on the agenda that are of public interest and within the subject matter jurisdiction of the district. The board has a policy of limiting speakers to no more than 3 minutes. The board cannot take action on items not listed on the agenda. Public input may be offered on agenda items when they come up for discussion and or action. Do we have any public comment?
There are no public comments online. Are there any public comments for items not on the agenda? No.
Awesome, thank you. Next item is E, consent agenda. Anything that would like to be discussed? Hold for discussion, if not, I'll entertain a motion to approve.
Motion to approve.
I'll second.
Okay. Any comments on that? Public comment on that? Seeing none, roll call, please.
Director Smith.
Yes.
Director Rogers.
Yes.
Director Perezville.
Yes.
Secretary Delara.
Yes.
President Barraza.
Yes, thank you. Next item is F, strategic grant funding. These are action items. F1, grant number 1572, Martha's Village and Kitchen, Valley-wide homeless. Recuperative housing and care services expansion for $167,000 with $15. If we can, how we've done it in the past, if we can get a summary from staff, and then we'll give representatives from that organization an opportunity to speak. And then we'll also have public comment and then comments from the board. Think that work? I believe that's what we've been doing. Else?
Okay, well, it's listed in your staff report for grant 1572. Village and Kitchen was vetted at program committee. Program committee recommended approval to the board. This funding will pay for the expansion of recuperative care beds as the homeless or unhoused are being discharged from local hospitals. There'll be 5 extra beds at the Palm Springs Navigation Center and 4 extra recuperative care beds at the Indio Shelter. They do have recuperative care beds now, that's being paid for by IEHP, but this is funding the gap that IEHP will not fund it. And there are representatives, I think, on Zoom. If anybody has any questions.
If there's anything that they would like to add before we open up for discussion?
Supposed to be SB or Alicia.
Any board member comments, questions on this item?
I have a question there.
I know that it's recuperative housing and care service for post hospitalization. And I'm just wondering if there is any participation, any coordination with the local hospital systems that are part of the grant. I didn't see that in the.
There's no funding, is that what you're asking? For many of the hospitals, no. But at SB 1152, by law, they have to make sure they're discharged to a safe.
Okay, so this is post discharge from the hospital.
And Alicia from Marcusville, the kitchen is online, if anybody has any questions.
I just have a clarification. So they mentioned the two sites and the one being in Palm Springs, that's the new navigation center. And the India one is at their main campus.
Yes.
Perfect, thank you.
Any other comments, questions? Any public comment on the item?
No public comment.
I'll entertain a motion.
So moved.
Second.
Roll call, please.
Director Smith,
Yes.
Director Rogers,
Yes.
Director Perezco. Yeah. Secretary Delara,
Yes.
President Baraza.
Yes. Thank you. Next item is F2, grant number 1584, Reynaldo J. Carrion, MD Foundation, Dr. Carrion Healthcare Scholarship Program in the amount of 143,750.
This is continuation basically of the healthcare scholarship program that we have funded in the past. Last year we did funded 15 students. This time it's up to 25. And they're $5,000 scholarships that will be awarded for those district residents that are pursuing a career in healthcare. And Kathy Macadera is here from called Safe House. She's been with Safe House.
Anything
Carry
that
on.
you would like to add?
No, we certainly appreciate the opportunity to apply for this. And it was a great success last year. And this year we'll be able to take it from 15 students to 25. And in fact, this year we're awarding more scholarships than ever. We're over $300,000. So, but these will all be healthcare related. And I really believe that your grant last year helped us in getting Loma Linda funding also for healthcare. We're kind of becoming specialists in healthcare scholarships for students. So very important.
Any questions or comments from?
Yes, did you have a question, Letty?
Yes, I have a question. Two questions. One, are the scholarships, is there an income eligibility?
Yes, low income.
Okay, good. And my second question is, do you have an idea of how many of the students are going into the medical field and what is the breakdown of them going into mental health? Do you have any?
Last year it was about 20% that were going into mental health. This year, I believe the ones that have been outlined, it's about the same amount. And some of the students are still studying biology or psychology. It's unclear as to where they will actually wind up. But we're trying to engage students at a senior level, a junior or senior level, that have picked a direction that they want to go. So.
And my last question is, and you are tracking this, so in years later, you can see whether they actually stayed in the field, is that correct?
Yeah, we're working with One Future. So I don't know, truthfully, that we have a mechanism in place for following post-graduation and into. And that's something I certainly need to,
Difficult subject for one future because they have to try, they're not required to stay in touch once they graduate, so.
yeah,
So they try and follow them through LinkedIn or any other kind of social media. And hopefully they supply their
we do, one of our board members who works at College of the Desert has started an alumni, an alumni group. So he's working closely with the students and hopefully maybe that will give us a better way to track.
Even if it's voluntary, but that would be good to have.
It would be good to
Find out why they changed it. If they didn't stay in the field, were there other barriers to?
Yeah, one feature because I'm available, I'll see if we can find it and send it to you all. It's, they do have stories of the ones that have graduated and where they are work.
Any other board member comments?
I would just second what Director Delora was pointing out, because I also noticed that for the two lower reviewers, that's what they were citing was the local data and the unclear connection to whether or not students are staying in the Coachella Valley. So maybe that's something to look at moving forward. How, if there's not a mechanism now, how we can establish one to ensure that we know, how many students are staying here, because that would be directed.
Well, that's certainly our goal and Mr. Students applied, sorry, I didn't mean to.
No, go ahead.
Supplied, that was part of the ones. We paid particular attention to the students who wrote into their letter that they wanted to stay in the Coachella Valley. So that is certainly something that we're working toward. We can't force them to stay here, but we will make every effort to try and.
We first started a scholarship program with one teacher 20 years ago. That was one of the things we did check with Jeff, that you can't require them to come back. They will, it's part of the grow your own workforce sort of thing, but legally, as Kathy said, can't. Work.
I don't think we want to keep them here unless they don't want to be, if they don't want to be here, but I'm just curious to find out what their reasons for not staying. Just to kind of learn about what the reasons, if there were some financial issues, if there's services that could be offered to help them to get education. Because sometimes it is they may want to do it in their heart and in their spirit, but they just can't for other reasons, but thank you for that.
I'll get together with one future and see if there's something we can devise that would be a better way of keeping track of that.
Thank you.
Any other board member comment? Any public comment on the
Not at the moment, no.
a motion,
I'll move approval.
roll call please.
Director Smith? Yes. Director Rogers?
Yes.
Director Perezkia? Director Longstreet?
Yes.
Secretary Delara?
Yes.
President Barraza?
Yes, thank you. So next item is F3.
I will.
Director Smith will recuse herself as she sits on the board for Planned Parenthood. So this is grant number 1604, Planned Parenthood of the Pacific Southwest, access without delay, expanding telehealth in the Coachella Valley in the amount of $23,433.
This is just to expand their telehealth services, reach more of residents in Coachella Valley telehealth. A lot of the changes that are happening. Telehealth is, serving food and they feel comfortable doing telehealth rather than coming to a clinic. So we're expanding. A portion of this grant is we're paying for 5 to 6% of the Coachella Valley residents that they've reached so far. That's why it's so low.
Do we have a representative from Planned Parenthood that would like to add anything?
Kirsten Deck and Violet Spencer. Which one is that? Kirsten.
Right here.
Yeah.
Kirsten, you have the floor if you'd like to.
Hi, this is Kirsten Deck. Can you all hear me okay?
Yeah.
Great. Thank you so much for considering this request. Our telehealth services are growing in line with the need that the community is showing us that it needs. And we're hopeful that this will be a small step toward a bigger impact that we can make in the Coachella Valley. Happy to answer any questions that you might have. And Violet Spencer is also here. She manages our telehealth program.
Awesome. Thank you. Any board member questions, comments? Any public comment on this item?
No public comment.
Entertain a motion. Whenever we're ready.
I'll
All right.
approval.
Roll call, please.
Director Rogers,
Yes.
Director Perezquio,
Yes.
Director Longston,
Yes.
Secretary Delara. Yes. President Barraza.
Yes. Thank you. Should we call Director Smith?
I'll get her.
Thank you. We'll wait for her to get back so that she can listen to your summary. Yes.
This one I'll read from the staff report because it's a little intricate. Hope you all read.
So the next item is F4, grant number 1605, Alianza Coachella Valley Air Filter Intervention and Respiratory Evaluation for Salton Sea Households, item, in the amount of $297,669.
This is an 18-month project that is a collaboration between Alianza Coachella Valley and Loma Linda University with Dr. Ryan Sinclair, who is on Zoom as well. And this is addressing a really severe environmental health crisis with the hydrogen sulfide emissions coming from the Salton Sea. And they will be testing the exposure. They are going to also be in collaboration with our own medical units to work with them in teaching them how to work with when they present different symptoms, if they're asthma or other health outcomes. Dr. Sinclair, who's the main researcher on this project, might be able to be a little bit more questions.
Director Luxus, you had a
I just had a
question?
question about they're looking at collecting, I think, data over long periods of time. And there's part of our funding is going to go to participant stipends, which isn't atypical from at least from a clinical trial standpoint. How much of those funds are directed towards just participant stipends?
You can just pledge it. And it's not a clinical trial.
Correct, but we do. So anytime you're trialing something new or you're running a study.
It's made more education and awareness.
Oh, okay. As I was reading through this before, it was around like retention.
It's work, they're having workshops and giving engagement programs. Stipends are per household total of 10,000.
So it says, yeah, funds also cover participant stipends to ensure the retention necessary. So that's what I was curious. How many participants were you expecting to receive those stipends, or what's the amount?
Tricia or Dr. Sinclair, can you answer that?
Oh yeah. Hi everybody, and thanks for considering this. I had written in there that our participants are going to be 50 participants, 50 households, and the stipend. I'm mobile right now. I can't quite look at my proposal right now currently, but there is going to be a small stipend in addition to the air filter that we're organizing for participation in the project.
Yeah, and I can
Sinclair,
answer
it's
that.
going to be, I'm sorry, it's going to be about $200 per incentive and
Yes.
distributed as $100 upon completion of the assessment and $100 upon completion of the close intervention. So
Yeah.
200 per.
Yeah, and I'm also here, Donna, in case you have any other questions. Thank you so much, everyone, for your time and consideration.
Tricia.
Thank you, Director Rogers.
I just have a question about, we're all about measuring outcomes, and is there some way to measure the impact of the effect of the project, including the purchase of air filters in terms of
Dr. Sinclair's role is going to be doing all that measurement, collecting the data, and doing a report out afterwards.
Doing a pre and a post.
clinical observation and through the DPMG Health mobile unit. So they'll be doing one at the onset and then one after they conclude the actual intervention. So we will be gathering that level of data.
Any other board member?
So my question is, the 50 people that will be participating in the study, I know that Dr. Sinclair is, very familiar with this topic and with the issues out in the Eastern Coachella Valley. So thank you for taking this on. My question is about the 50 people. Are you looking, what is your criteria for identifying the 50? Are you looking to, I know you probably have some science involved in it, but can you tell us a little bit about what you're looking to include in this the study, the 50 people, different regions, ages, different health conditions, who is referring them? Could you just tell us a little bit about the 50?
Sure.
Yeah.
Go ahead, Patricia.
Oh, good. Thanks, Ryan. Yeah, because I know Ryan has limited access to internet right now. So the 50, it would actually be 50 households. So we're actually going to be measuring and being in communication with more than 50 individuals. We're looking at 50 households. And so the 50 households primarily that we would be looking at would be the communities in Thermal because they're in closest proximity to the sea. While we are actually including families throughout the Eastern Coachella Valley, which includes Mecca and North Shore as well. And so part of the outreach will include doing door-to-door canvassing as well as social media outreach to encourage folks to sign up, for the 50 households to sign up. And part of the criteria would be for them to at least have one individual in their household that has asthma or asthma-related symptoms. Our team of community scientists has been collecting data regarding the impacts of the Salton Sea since 2019. And so they've been looking at the impacts of the Salton Sea and the hydrogen sulfide, that some have been considered asthma, but when they look at it, it's also asthma-related symptoms. So we're looking at folks who have asthma or asthma-related symptoms. And then, as it was mentioned by the Desert Healthcare District staff, we're going to be doing a pre and post evaluation as part of the clinic to be able to look at solution-based efforts, which would be the filters. So each household would be provided with an air filter to be able to monitor the improvements in their health across the board for all the families who live in that household, in the 50 households.
Thank you. One more follow-up question. Okay, so I know that we're only focusing on the Coachella Valley for this funding, but the one thing that caught my attention in the review by the reviewers was the comment about the partnerships that you have to be able to do this really good, thorough, comprehensive study. I was just wondering, outside the Coachella Valley, in the areas surrounding the Salton Sea that are not in the Coachella Valley, do you have plans to study that area as well?
Yeah, so we actually are studying the other areas. So aside from this project, which we're really thankful for, the partnership that we started with Alejandro and Desert Healthcare District and SQMD regarding the Air Quality Academy. Once we completed the Air Quality Academy, we actually received funding from NASA for a year, and we were able to deploy a monitor on the Imperial County side. So we actually currently have a data dashboard that's available through our website that's tracking the data and the impacts of the air quality, and specifically looking at hydrogen sulfide, both on the Riverside County side and the Imperial County side. And we've hosted workshops for both communities on both counties regarding hydrogen sulfide that was previously funded by NASA. And we still have active monitors till this day in multiple areas surrounding the sea.
Thank you.
Awesome. Any other questions for board members? Any questions or public comment?
One last question. What's the deliverable out of this? Is there going to be like a paper published? Is it going to be something you're going to have to be able to go out and educate the community from the results? What's
There will be a report.
the report? And that's a report, and we can go to other community members.
Yeah,
Well, I'll only mention it from a marketing standpoint too, that, if there's gonna be a publication or if this is gonna make it into a journal, it should be noted that we helped fund that, and I think that's really good recognition for the board and for what the healthcare district is doing in the community to sponsor research like this.
It's an IRB, so
That's what I'm saying, so there may end up being he may end up publishing,
we did ask if we make sure funding was available from this healthcare.
but that'll actually go in the article itself, is where it's funded, and
Yeah, there will be a report that will, showcase the support from Desert Healthcare District. We just released a report not too long ago regarding our hydrogen sulfide previous work that acknowledged NASA for their support in that phase of our project. So we'll definitely acknowledge Desert Healthcare District for the support in this project as well.
One thing to note as well is that this is only 50 households out of the hundreds, if not thousands.
Yes, yeah.
That are there within the influence of the Salton Sea. So I think this is something that could potentially be expanded for additional beyond the 50 exactly. Yeah, so this could be possibly like a pilot study, for lack of in better terms. So maybe we could expand this at, once we kind of get some of those reports and some of that data that will be collected through the process.
It also builds up, board members, I just wanted to say it also builds up the capacity, or rather training of the mobile clinics, the mobile units, to go out and address some of these issues. And, we're going to find out, hey, do those air filters, are they an adequate or excellent or not very effective at reducing these air contaminants in the home in terms of actual health readings? So that's another thing we're going to be able to answer after this. And it'll all help the Desert Healthcare District in, addressing some of these respiratory problems that are out there.
Dr. Ross?
I have a question about the air filters. I have my own air filter at home, and it's only good for so many hundred square feet. And I notice that we're looking at installing them in mobile homes and stick homes that may not be air tight. So is there going to be some way to accommodate the homes themselves so that the air filters are more effective?
Yes, and so that's one of the things that we will be looking at, especially because some of the mobile home parks, they do need weatherization support. And so as part of the installation of the air filters, Loma Linda University and Alianza will work with the community members to do an analysis of their home to make sure that their windows are sealed and any other areas that need attention, so that we can be able to ensure that the use of the air filter is used as best as possible for the community members within their home. And then there's multiple options for air filters through the South Coast Quality Air folks. And so we're going to be able to give folks the opportunity to choose between a few options that would best fit their needs within their specific home, as some do live in mobile home parks and then some do live in larger homes. So depending on the size of their home, we'll work with the community member to see what their needs are to ensure that the air filters are the best fit for their home.
Number 2, we have those 5 organizations that formed that alliance from the RFP mitigating air quality. So they're all in that area as well, and working with CalAIM and getting those different supports for the air quality and the different monitors. So they'll be working with them as well, with sharing information with them.
Make a motion to approve.
A second.
Okay, thank you. Roll call, please.
Director Smith,
Yes.
Director Rogers,
Yes.
Director Perezquio,
Yes.
Director Logston,
yes.
Secretary Delara,
Yes.
President Barraza.
Yes, thank you. Next item is F5, grant number 1609, Braille Institute, Coachella Valley's telehealth services, low vision rehabilitation and vision loss support groups in the amount of $45,000.
Okay, and this grant will help support the partial salaries of 5 of those low vision service personnel, which offers therapy support groups for those that are impacted by their sight. And yeah. Catherine's here from Braille Institute, if anybody has.
Would you like to add anything?
Sure, I'll start by saying thank you so much to the Desert Healthcare District for supporting the telehealth services that have been associated with our low vision rehabilitation program. And through that growth, we've identified a huge need in the emotional support or mental health area. Many people who have been sighted all of their life who then come to age-related vision loss go through some really difficult transitions. So we now have a permanent social work crew that are supporting that. And this is exactly why we are working this project. Happy to answer any questions.
Thank you. Any questions from the board? Any comments? Any comments from the public?
None.
Okay. Happy to entertain a motion. You're ready for it?
Move to approve.
Roll call, please.
Director Smith,
Yes.
Director Rogers.
Yes.
Director Forestio,
Yes.
Director Logston,
Yes.
Secretary Delara,
Yes.
President Peraza.
Yes, thank you.
Before we move on to the next item, I just want to state that I hope that you will actually expand to other sites. As this program, gets started, I would like to see more sites. in the future.
Sites, you mean
Like
locally or?
the partnerships that you have to provide on-site services.
Mhm.
I would like to see some, like Thermal, Mecca, having some sites out in the Eastern Coachella Valley be included at some point in the future.
Okay, I'll pass that along.
Thank you.
Thank you.
Thanks. So next item is F6 fiscal year 2025-26. So it's a grant budget increase, the amount of $760,237.
Eric will help us out with that one. Thank you. No problem. So yes, at the March meeting, when we had approved some of the grants, which had exceeded the current budget of 8 million, that potential increase of the grant budget had been postponed just to allow for the due diligence process on all the remaining grant applications we had received up through that March 1st cutoff date. So at this point, all those applications have been processed and the items are on the agenda today as far as the approvals, which we just approved, as well as the declinations. And so the 763,000, and there is a proposed grants report right behind it in the packet there, would cover the over budget value that we had as of March. There are 2 pending mini grant applications, which has made its way through the due diligence process. We're just waiting for the final elements to make the determination, as well as the 5 grants that were passed today. So we're recommending increasing the budget to 8,763,237 for this fiscal year, which would cover all the approved grants and anticipated mini grants for the fiscal year.
Any board member comments? Go ahead, Director Luxon.
So for the total year, fiscal year, will actually show a net loss on our budget, on our overall, right?
Correct. Estimated, all depends on how the final expenditures and revenue comes in, but that would be based on the original budgeted value. Yes, it would, the end result would be an anticipated loss of 644,000 for this fiscal year.
And then our next fiscal year starts,
July 1st.
so if we were to just delay these to July 1st, we would look like we were within budget for the year.
Trying to think back, because we passed the budget already for the next fiscal year, but I don't recall, Don, we have a couple of these that start.
Seems like this should have been put on the budget for next year. It wasn't presented for the budget items. So now it's being asked to fund more for the past year to show that we have a loss instead of just adding it as a budget item to increase our budget for next year.
Well, I think the key is with these, since they've been approved, those would be expensed in this fiscal year, wouldn't be delayed. Several of the grants, there may be one that starts July 1st. I don't recall offhand, but a lot of those are anticipated to start June 1st is usually when we're bringing them. They're already planned, so it wouldn't really be something to postpone. I think the other element involved with this is these were all submitted into the current strategic plan. So postponing those kind of poses a new potential challenge as far as where they fit into the new strategic plan.
Sure. And this is going to be our 3rd budget increase for the year.
This one.
Be the second. Second, yeah. Because we had originally five million, then we increased it to 8 million, and then we decided to do the cutoff of March 1st and then evaluate any additional grant applications at that point. And then any that were approved from that group would potentially increase the budget for the remaining of this fiscal year. So this is it for the fiscal year. There will be no additional grants to bring for this fiscal year.
I just think it's very bad performance of a public institution. Budget increases happen, things happen, but then to show that you have a loss for the year, it's just a bad representation to the public that we didn't plan anything and that we're just overspending regardless of what we show income. And I know we have money coming in, right? But our job is to budget with like fiscal accuracy because these are publicly funded dollars. So I just think it's how we go about this. I think it's very important. I think it's a lot about a perception with how we're spending money. And I said that the last time too. I think perception's everything in the public eye. So I don't know if there's a way to do this that you don't have to show a net operating loss for the first time in how many years? You know?
Well, but I think if we look forward, any of your years going forward, especially if we're utilizing resources from our investment accounts and also these, we are going to show operational losses because we're not utilizing the resources.
Depends on how we
we
discussed in the budget meeting. Like some of the funds that come in from other sources can be used in a way separate from the actual operation of our organization, right? We discussed that those may be funds that are allocated somewhat separately from the actual operational budget. We went over that, I think, in detail at the finance committee. So, I mean, is there any way to structure this such that these can get funded and we can maintain within our budget for the year, seeing that it's only about 6 weeks away until the next fiscal year?
That was one alternative view, kind of as we did in F&A. When we're talking the fiscal loss, that's only for that period of time. So we have had excess funds consistently in the past, which has resulted in increasing our reserves. And so really this is just utilizing those reserves. I get the concept because we talked about it at the past meeting, but
And maybe how it's presented should be different. I mean, we just sold a property and collected $3 million almost. So maybe instead of declaring it listed as a net loss, that just the wording and the perception of that, I don't think comes across very positive. If I was to read this as somebody evaluating the function of a public entity and say, look, we've received additional funds from other sources and those are going to be allocated to meet the needs of our community outside of what we originally had budgeted for.
But we're an accrual basis.
I know.
Organization, so there's also depreciation, non-cash items that are in this type of deal. And I guarantee you going forward, every year will show a net loss.
It will because of how we're bringing in the additional funds and how they're spending.
And that's the only way you can utilize those resources in the investment account if we're going to put more monies and effort into our.
But that would be a budgeted plan for a net loss. This isn't a budgeted plan net loss, right? Our budget that we lay out for the year will show that we're going to spend this and we plan for a net loss. We didn't plan this year for a net loss.
But the board has directed to do things in the past that we now are making those decisions on. I mean, if that was the case, then we should not have said that was okay to take more grant applications in because
I think you're getting to the point that I'm
do that
bringing up.
Point that we'd already upped it to 8 million.
I think you're,
and yet the board.
You hit the nail on the head there. I think going forward, I think we need to be very aware of how we're spending it. We can plan for a loss because we have funds coming in. We know that. I think the idea that we run without guardrails, which is how I view this, continually, like we should have planned when we asked for the 8 million, it should have been 8,762,236, whatever. Like we should have had a plan. We should have went to, if we really thought it was going to include these, we should have went to 9 million. So we didn't have to go back and now run a loss because we would have adjusted the budget before this. And that's my point. And I think for the board, it's like, let's really be careful about how we structure the budget for the year. And I think we did a really good job, and you're going to see those numbers here in a minute when we get to it. But about planning for a net loss is okay based on how we're structuring the funds coming in. But just adding additional loss that's unplanned, I think is a really bad precedent to set. And maybe this is how we have to do it this year, but I think going forward as a board, we have to be very cautious to make sure that we're staying within the guidelines that we set. Otherwise, we have no guardrails that are really governing how we manage our fiscal responsibility.
Thank you.
I've killed it.
Director Long.
Well, the only point that I'd like to make is that in the past, this board has always accommodated unforeseen circumstances and have increased our budget accordingly. I've heard Director DeLaura say that we can always amend our budget based on the circumstances that face us. And I'm totally happy with accommodating the increases in this budget. I think it shows that we're being responsive to community needs, which is our job.
Thank you. Other comments? Director Lina?
I understand Director Logston's reasons for bringing this up, and I appreciate the fact that he's bringing it up so that we explore the possibility of ensuring that the story is accurate, that we are being very cognizant of the expectation from our constituency to be responsible with the public dollars. I totally understand that.
Thank you.
The other part of it, though, is that we have been dealing with this issue for the last 2 or 3 months. So it's not something that kind of snuck up on us. It's something that we've been working towards. And as we're closing the book, getting closer to close the end of the fiscal year, I appreciate the fact that he brought it up again, that we would have liked to have done it differently, but we didn't anticipate it. We didn't have that crystal ball to tell us how many grants were going to come in. But we knew that the need was great. This is a very tough time for many families, and I appreciate the fact that we can be flexible and that we have our staff that are continuing to, to find ways to make it happen. But it is our responsibility to ask these tough questions to ensure that we are fulfilling our responsibilities. I appreciate that.
Thank you. No, appreciate that.
Any other comments or questions from the board? Any public comment on this item?
No public comments.
Awesome. I'll entertain a motion.
I'll second.
Okay. Roll call, please.
Director Smith? Yes. Director Peters?
Yes.
Director Perez-Gill?
Yes.
Director Longston?
Yes.
Secretary DeLaura?
Yes.
President Corral?
Yes, thank you. So could you please remind me if for the next item, we were going to vote on all of them as one?
Yes.
Okay, so next item is G, grant application declinations for the fiscal year 25-26. You want to go ahead and provide a brief summary on these altogether?
And then this was these were part of the 38 that came in totaling $18 million. And then we looked at all the grants that came in based on the direction the board gave staff that they had to meet high priority goals 2, 3, or 6. And they had to show direct needs, healthcare need. So a lot of these, some of these, we can look at it as later on when we are going to be doing RFPs or how we're going to be doing our grant. Health systems amplifier, that some of these organizations would be able to work with us in partnerships to be able to move the needle on our pillars and our initiatives.
Thank you, George.
Thank you for that. And I have a question about 2 of them.
Okay.
Just handle them both since we're doing it all at once. Okay, so the first one, number 1, grant number 1578, College of the Desert Foundation. So this one was declined, reason given strategic timing. And so I'm curious about this one in particular because of the nature of the program. It is workforce development for individuals who, more likely than not will proceed on to be paramedics right here within the district. So I'm curious about that, especially because the program launches September 2nd. So is there any possibility of like bridging that or? Because I'd hate for us to not, because I understand strategic timing and it aligns with, and I think you all put it in here that it directly aligns with our incoming plan, pillar number 1, workforce development. But I do just wonder, like, are we, because I know there were a lot of grants to look at, but are we just not going to consider? Is that what is that where your mind's at from now? Or are they being encouraged to reapply in the new fiscal year? Like, how can we, because I think this is a program that directly goes to what.
This is a very important program, and we had a very long conversation, grant consultation meeting with COD. Right now, they're going through another, I think it's called PACE. It hasn't been accredited yet by the College of the Desert, so that way the students cannot get any kind of financial aid until they become accredited, then they can get financial aid. So this was kind of like almost like a gap of giving the person that would be interested in being, or is already employed by AMR, or it's already a paramedic to learn how to be an EMR. And so it's kind of almost like a pass through of dollars to give the individuals who are currently employed. But AMR doesn't even want to fund it at that time because they had some kind of lawsuit with the union. And so we were more like want to watch it just to see when they get the accreditation so that these individuals, they can go through college, One Future Coachella Valley and get the whole support, get financial aid, soup to nuts, and get the whole kind of wraparound services. So we are looking at it. It is for the workforce. There's a shortage of EMTs. But the thing is too, they're already employed. If they were given time off to go to school, they have to try and find somebody else to take that place. And there's already a shortage. So it's kind of almost like a catch-22. But it is on our radar to look at, especially for pillar 1 with the workforce development.
Yeah, I just wondered because, all that makes sense. And we put so much, into the report, but I was just kind of wondering, strategically, because the reason given was strategic timing. So, okay, makes sense. Thank you. Oh, yeah,
And then
I did
the
have a
other
second
item?
one.
On that,
Oh,
before we
go
move
ahead,
on.
sorry.
So I think that's something that we need to be aware of is that like this program, it may be that there's other issues involved with the accreditation. But I know we talked about when we would be ready to release a new RFP and there's a lot of reasoning why we want to move it out because of staffing and things, but keep in mind that there's a lot of organizations that are waiting for us. So we have to kind of be aware of that, is that we would want to wait for a year, but
Remember, we're not supposed to be reactive grant makers anymore.
I know, exactly. We want to be proactive and some of these programs will fall into that. But we have to also keep in mind that as we are looking at wanting to wait for a year out, is there another, a timing that will work, that will, keep in mind that there are organizations that would fall into those categories that we could fund and that maybe we just need to keep that in mind. Okay.
Any other comments on that particular item? If not, Director Smith,
Yes.
your second one?
Yeah, it's my second one.
No, you're good.
So my second question is about Respira. Oh, sorry. Yeah, number 4. Thank you. So this one, I'm also curious about because it's, this grant, the work they'll be doing also goes to air quality, respiratory health, et cetera. But we approved the Alianza grant. So I just want to get like a clear explanation about the difference between those two, why the Alianza grant was for approval, but this one was declined and they're kind of both doing the same thing.
And this grant that they wrote was kind of almost specific to the RFP that we put out for mitigating air quality. Employing community health workers to go out to the community and do events and workshops and things like that. So we really wanted to wait because it's almost exactly the 5 that were awarded for the RFP. We wanted to see as well what their outcomes are going to be from our alliance with the 5 and how it can tie into this. So again, this one is still on the radar as well, especially with the asthma, but and this was for 3 years. Well, where we had also gotten board direction, it should only been 1 year.
Is there like a potential for collaboration between the two? Okay. Or is that happening already?
They're pretty much a lot in the community. They've got some other open grants with us that are part of an RFP with behavioral health, I believe, and social isolation grant. And then I know because Alejandra's kind of the lead on the alliance with this there's five organizations that are going on their second year of mitigating air quality, so.
Second of 2 years, or is it second of third year?
Going to the second year of a 2-year award RFP too. Thank you.
Any other board member questions? Comments? Any comments from the public?
No public comment.
For that, I'll entertain a motion.
I'll move to approve the declinations.
I'll second that.
Roll call, please.
Director Smith. Yes. Director Rogers.
Yes.
Director Perezville.
Yes.
Director Longston.
Yes.
Secretary Delara.
Yes.
President Barraza.
Yes, thank you. Next item, very exciting one, is H. 2027-2031 strategic plan adoption.
Yeah, so as we all know, we've incurred probably 10 months going on 11 now. And a very extensive strategic planning process with also the outreach to the community, getting community feedback through 7 in-person sessions, 1 virtual session, and also several board workshops, and work with someone who has proven to be a great team that we have worked together with. And we did, a couple of weeks ago, review a final update on our strategic plan. And this is the final summarized version of the strategic plan that we're asking for adoption at this meeting today.
Any board member comments? No? So for me, as board president, I'm proud to support the adoption of our new strategic 5-year plan here with the district. I would like to thank our staff members, Soen, for guiding us through this process, the members of the public that engaged within this process. This plan reflects our commitment to improving access to healthcare, advancing equity, and addressing the evolving needs of our communities. It provides a clear roadmap for collaboration, accountability, and long-term impact as we continue investing in the health and well-being of the residents of the Coachella Valley. With that, I would like to make a motion to approve this.
I'll
For
second.
adoption.
I'll second.
Any public comment?
Sophie, did you have anything to say, to add?
No, I just want to thank the board and the staff and the community and just echo your comments. And it's been an amazing process, and we've been very honored to be part of it. And we're very excited to implement this plan we can make on the community. So thank you very much to everybody.
Any comments from members of the public? Alrighty, thank you. Do we need let's do a roll call.
Director Smith. Yes. Director Rogers.
Yes.
Director Perezville.
Yeah.
Director Longston.
Yes.
Secretary Delara.
Yes.
President Barraza.
Yes. Thank you. Next item is I reports. I1 Desert Regional Center CEO report. Michael DeToro. Welcome.
Thanks.
Oh, we forgot to move the podium for you.
Congrats on getting your plan approved. That was a lot of work. Nice job. The updates for Desert Regional, updating on 2 survey activities we had. Joint Commission was out to reaccredit us for our advanced certification in the perinatal space. This encompasses the work that we do in our maternal fetal medicine clinic, inpatient maternal fetal medicine work, labor and delivery, neonatal ICU, pediatrics, all of it and how it works together. The team really highlighted a lot of best practices, and we're quite complimentary. And, I think we've got a lot to be proud of in the services that we've provided there. And for anybody who's had loved ones that have been there, we're really proud of what we do. From a graduate medical education perspective, the ACGME, which is the accrediting body for GME, gave us continued accreditation status for our institutional designation, which allows Desert Regional to be a teaching facility, as well as We had continued accreditation in all of our individual programs, and continued accreditation is the best level of recommendation you can get from those visits. So nice work on the survey fronts. Director Delar, I updated something for JFK on here for services. JFK has applied to be a level 3 trauma center with the American College of Surgeons. We will go through that process to bring them up, targeting 2027 in December to get our ACS designation. We've brought a lot of new physicians into Desert Care Network in the last few months in specialties of colorectal surgery, OBGYN, breast oncology surgeon, and medical oncology. That recruit is underway. So we're excited to bring some of these specialists in town. So we can provide the level of care patients need and don't have to leave the valley to get that level of care. And then from the events and media side, we had a lot of stuff. I'm just going to highlight a couple in here. We had our 2026 research symposium for GME. So we had 23 research projects that were done by all of our residents and some medical students. This was 10 more projects than were done last year. Really great engagement from the residents and the fellows who did these projects, as well as our attending surgeons that they either collaborated with or asked questions. Some of these projects got approval to be presented at some national conferences. Like we have 2 that are going to be presented this weekend in ASCO, which is the American Society of Clinical Oncology in Chicago. These meta-analyses looking at some of the work that's done in that space. So really exciting stuff done here at the hospital being presented nationally. So we're really pleased with that. And then the last one, with EMS Appreciation Week last week, we had a nice event where we brought in a lot of the EMS paramedics from AMR, CAL FIRE, REACH, and Mercy, and we gave awards to 5. I learned we had over 1,300 EMS agents that come into the facility each year, and our team voted on the ones that they thought that were really the strongest. So we recognized 5 individual EMTs for their continued excellent work that they do. And then we brought in specific teams and highlighted 3 rescues where our paramedics really saved lives in the field and brought them into the hospital, and we finished it and helped take care. So it's really highlights the collaboration and the partnership between the hospital and the field. And we recognized a team that rescued a gentleman who was nearly drowned in his own pool. And they came in real emergently and saved this man, brought him in. He had a few days with us. He was able to get back safely to his family in Tennessee. And then we had 2 separate air rescues that came in for different trauma events. And we were able to bring in the individuals that were saved by these efforts to then meet the first responders. It was just a really nice event. We got some nice media attention from it. So with that, the rest of what I have is in the report. I'll take any questions.
So since you brought up JFK, I'm just gonna mention something to you and see what your response is. The festival season's in April. Okay, Monroe, right in front of the hospital. That is an area that most residents stay away from because of the long traffic all the way from the exit ramp all the way to Avenue 49. It seems like if this year it was, there seemed to be several times when there were problems in front of JFK. Is it my imagination? Is it just people telling me differently that there seem to be more problems this year? How do you handle that with trying to get an ambulance in there when you have all of this traffic?
Was there a problem with EMS routing or?
Trying to get in there, is it, because several people told me that, because I live in the area, so they were just telling me that this year it seemed like if it was a bigger problem that people are just, I guess, more rude and trying to let people, even respecting emergency vehicles and stuff. But do you have a actual way to deal with that?
We certainly need to work with the first responders, and if 911 were called, I know they have a way that they can get through, and certainly, you've probably heard reports that sometimes people don't move for ambulances, but they they know how to do this. As far as the direct community, if they were driving in, it's an interesting,
So you haven't heard
interesting
complaints
thing you brought
about
up.
it?
I haven't heard complaints.
Where's Linda? Okay.
Linda,
Okay.
go.
Okay, well, I'm just curious if that was something that had been brought up, if it was a problem in the past, or if it was a problem this year only. But I'm just curious if that's something that the city involves JFK in reviewing, after the event, kind of doing a synopsis or.
After action, yeah, we actually do pre-planning with them for the event each year, so, definitely that can be something I'll let the team
Yeah.
just bring up, make sure they address that issue.
Okay, thank you.
Yes,
Thank you. Any other board member comments or questions? Awesome.
Thanks.
Thank you. Alrighty, our next item is I2, Desert Regional Medical Center Governing Board, Director Rogers.
It's me, yes. Mike left one of the most exciting mentions for me to bring up, which is in the report that was just published this morning. And it had to do with seismic update for Desert Regional. The medical center has appointed working with a architectural firm locally, which is really awesome that we don't have someone from out of state or whatever that is knowledgeable about building codes. And we received a report showing some of the areas where the hospital needs to have structural reinforcements. One of the major areas that I didn't realize is that excuse me, Mr. Rogers. One of the major areas that need to be worked on have to do with water storage, sewer storage. And these are off, they're not, in the hospital itself, they're out in the parking lot areas. So that there's major work that needs to be done on that. They did talk about the fact that there are 21 buildings that need to be part of the reinforcement to meet structural or seismic guidelines. And there are over 200 pages of individual drawings that are still in draft form because they submitted to the state for approval. But so as a draft form that they're not permanent, the state must approve those or change their requirements for those drawings by the March 1st of 2028. And that once approved, permits will be issued and all construction needs to be completed by the January 1 of 2030. So a lot of work to be done there. I think that we had a long discussion with the board about the impact of patient care with doing structural excuse me. Mr. Rogers can't get in the front gate. So we talked about the impact on patient care, which is always my concern. And then we also were knowing how the state proceeds with issuing permits, whether it would even be possible to get the permits in time to have the construction completed. Did I do okay, Mike?
You did okay, yes.
Thank you.
I would highlight, in the plans that we saw, there's 3 distinct builds for the facility. The original building, which is the east tower, east side of the campus, is the one that requires the majority of both the structural and non-structural work. And the Sinatra Tower, which was built in the 70s, is much more compliant and doesn't need the amount of structural work. And then the west side, which is the ER, labor and delivery, the NICU, that's all up to code in terms of the structural stuff. So that means not as much. It's the non-structural, which is the anchoring of like pipes like this to make sure when something happens that the either air that feeds a place or the water that feeds it, that those don't, get dislodged. So ton of work has been done. We're pleased that we've met all the deadlines for submission. And I just wanted you to get an idea of the depth and breadth of the amount of work that team has done. And the architects we're using are local architects. They've done the work in the hospital for the last 3+ decades. So they know this place in and out, and it's good to have that expertise with the familiarity of the building. And they understand all the work and the additions that have been put on in the last several decades. So lots of good work on that front.
Thank you. Any questions from the board? This report? No? Thank you, Director Rogers. Next item is I3, Desert Health District CEO report. Chris?
Okay, thank you, President Barraza. So the first item is the governance workshop that was just held on Thursday night last week with Larry Walker. And for those present, we got to hear some, I think, good communication, good work, good feedback that was coming from the directors. There was some discussion about possible things to consider in our governance work. Also, we addressed and looked at possible updates or changes to our board meeting agendas for us to consider. I think next steps that came from that was to perhaps kind of re-engage our governance ad hoc committee and also with our staff communications, board and staff communications committee as well. So those were my takeaways from it. Those directors that were present, any additional comments?
Any questions, comments? No? Thank you. You may proceed.
Okay, next item on the agenda, which we're really excited about. A couple of months ago, we did present that we did receive from ACHD the certificate of transparency, which I think Eric and others of our staff that worked to put that information together. This is similar to that with CSDA, which it's all about transparency. It's all about the district in being in compliance with the kinds of work, like, some of it isn't easy. I mean, we have to do our individual certifications. So like our ethics certifications and other things, maintaining our Form 700s and being in compliance and then being transparent about all these things with our audit reports and budgets, and anything that we have would be easily accessible to our websites, et cetera. So we recently then were awarded the Transparency Certificate of Excellence from the California Special Districts Association. There's a letter in the packet. There's also a letter that we can use for a public announcement. And then we also received a stamp or a logo that we can add to our signature of our email if we would like. And just to acknowledge that, that our district is meeting those requirements that look very positive to our community and those that look at us as a transparent organization.
Any comments or questions?
Okay, next item is CEO engagements and district media visibility report. If you have any questions, it's in your packet. And I do have one item that is not on the agenda.
Any questions or comments on that report?
Okay, this one I want to stand for. I have a little report I would like to communicate publicly and transparently to the board and to staff presently. I would like to share a little bit about principles and values, or more specifically, ethics and integrity. Ethics and integrity are often used together, but they are not the same thing. Ethics are the rules and standards that guide what a society, profession, or organization considers right and wrong. Integrity is more personal. It is the courage to consistently live by those principles, even when no one is watching. A person can know ethical rules and still fail to act with integrity. Ethics provide the knowledge of what is right. Integrity determines whether we actually do what is right. Integrity is revealed in everyday decisions, telling the truth when it is uncomfortable, admitting mistakes, honoring commitments, and treating others fairly. And it is not built in a single moment, but through repeated choices over time. People with integrity earn trust because their actions match their values. In leadership, business, education, and personal relationships, ethics create expectation, but integrity creates credibility. Rules alone cannot build strong organizations or communities. They require people willing to uphold those values consistently, those with integrity. Today, we live in a world where public image often matters more than character. But reputation is what others think about us. Integrity is who we truly are. Ethics may tell us the right path, but integrity is what keeps us walking the path. In the end, ethics define the standard, and integrity is the commitment to live by it. Together, they form the foundation of trust, respect, and strong character. To bring this more into context, a year ago during my annual CEO performance evaluation, our current board president, President Barraza, made false and unjustifiable claims of unethical judgment and inequitable bias, to which I was astonished. I am a certified public accountant, which requires a high degree of ethics to maintain my license. I value my ethical standards, and I would never, ever allow my ethics to be compromised. So this accusation was very personal. My annual performance evaluation this year began on March 25th, with a scheduled completion by today, May 26th. That's 2 months. Due to last-minute procedural revisions, several intentional delays, and non-responsiveness by President Barraza, the performance evaluation continues to be delayed with no end in sight. I have yet to receive my formal evaluation 2 months later. This raises concerns of lack of respect, professionalism, and even harassment of a public employee. At this point, the earliest that there could be any decision made is now June 23rd, which would be 3 months into a performance review process. Ethics and integrity mean something to me. My integrity has been challenged several times by the board president over the course of the prior several months, to which I have stood up for my principles and values. I have been told by some recently that I must not speak negatively to or about President Barraza and must respect her. I suspect when I receive my performance evaluation, I will be expected to compromise my integrity to maintain my employment. For me, I prefer to maintain my integrity. And respect and trust are earned, not demanded. Thank you. That concludes my report.
Next item is I, Ad hoc Committee on Legal Services.
Yes. Thank you, President Peraza. All right, so you all have asked an attorney to give a report, and so I'm giving a very thorough report, so I just, bear with me. I want to make sure that we understand here the background of why we formed this ad hoc committee, so bear with me. At the February 11th F&A committee meeting, the committee discussed the option to continue with current legal counsel or to consider developing an RFP. The committee directed staff to agendize a future discussion and possible staff direction at a later date. This is based off of board policy OP-11, procurement of purchase contracts and professional services, states in section 1.1, professional services, legal services, audit services, and investment services shall be reviewed and potentially bid every 5 years. So per the reference policy, the F&A committee considered the option to continue with current services or to let staff to create and execute an RFP process. Current legal counsel, Jeff Scott, has served as district counsel for many years, dating back to the 1990s, with a short break between 2011 to 2016. And so moving forward, at the March 10th, 2026 F&A committee, the committee recommended discussion by the board. At the March 24th, 2026 Board of Directors meeting, the board concluded to form an ad hoc committee for general counsel review, which was created at the April 28th, 2026 board meeting. And so that committee consisted of myself, Director Perez-Gil, and Director Lobstein. So now that we have the background, the actual committee meeting. And so prior to that meeting, we received a packet, which included a staff report, the policy, and a staff developed evaluation form. I think about 2 days before the meeting, Jeff, our legal counsel, also emailed us the policy with some edits, as well as I believe a version of an evaluation form that was presented. It was sent to the committee. And so the committee agreed that the policy revisions should go through the policy committee. And we decided to move forward with the staff's version of an evaluation form. And so we accepted that version and recommended that it be presented to the board at today's meeting. Now, there was some uncertainty that we discussed about how to confidentially collect and complete the evaluations, compile a summary, and deliver feedback so that it would be confidential. And so 3 options were discussed. The first is that the completed evaluation forms would be returned to the CEO to summarize and then provided to myself or President Barraza. The second, pending input from Jeff, would be to conduct a closed session with the full board to discuss individual evaluations together. We weren't sure yet. I know, Chris, you were going to check with Jeff about whether or not we could do that. And then option 3, which I felt was the most viable, was to engage a separate independent legal counsel to guide the process and ensure unbiased guidance. And so that was the finding of the ad hoc committee at that time, that we would recommend proceeding with an evaluation. And it was the evaluation that staff had provided to us.
Thank you.
Thank you.
Any questions, comments on that report? No. On this end, I'm like, all right, so I have.
So are we expected to make a decision today?
There was more of a report. I know there's a recommendation. Sure.
I am not understanding. I know you probably put a lot of work into it, and I appreciate the work you put into it. But and your effort to condense it and to make it simple. But I still don't get it.
Okay. So the recommendation from the committee was to move forward with an evaluation before making a
The
decision.
evaluation is what's confusing me. Who's
Yes.
gonna do who's gonna complete the evaluation?
The board.
Oh,
will
we are going
complete
to
an evaluation.
evaluate the current attorney.
Correct. Yes, that was the decision that was made about me to do an evaluation. It is not required under the policy, but we determined that would be the most fair way to move forward because we are not required to issue an RFP. It's an option.
Okay.
When is your contract due? Jeff? When is your contract due?
Well, I mean, I think whatever the board decides, it's fine with me. I think the recommendation is to at least, let's have an opportunity. Staff provided an evaluation form that the committee looked at felt was appropriate. And that would be the first step, is to see, hey, let's get some feedback from the board about the services of general counsel. And then just make a decision after that as to whether or not you want to go out for an RFP. That seems to be a pretty reasonable approach. So
The reason why I'm asking is so that if the board decides to move in that direction, that it's somewhat aligned to when, I don't think that it's something that we need to do that does not align with the time or the process of like your next, or whenever your contract is due. I can't remember when the date is. That we recently.
I serve at the pleasure of the board. So at any point, the board can relieve me of my duties. I don't have a specific term. It's up to you folks, and it's your discretion. So we just thought that as we went through this, that it might make some sense to get some feedback and to see where we were at with respect to, my services and the satisfaction with that.
Yes.
So we're going to be given a survey, review.
Well, no, it's a fairly, it's an evaluation form that the staff's prepared and it looks, it's in order. And that's, I will tell you, that's typically done. That's how you have, whether it's annual or every couple of years, but you basically, that's how you get feedback and see if there needs to be corrective action or whether or not it's time to move out and get a new counsel, or at least look at some other options. That certainly seems reasonable to me.
What it was that us as an ad hoc committee, we decided on forwarding to the board so that the whole board could agree or not agree on an evaluation for him. So that was the original recommendation that was done by us. And that's what Anise was covering, that we had made that recommendation. Now it's up to the whole board if we want to decide whether doing a CEO evaluation before putting the RFP out is a good idea, or if we just put the RFP out. We made a recommendation because that was what was asked of us.
Do you believe, and I guess I'm talking to the ad hoc committee members, do you believe that you would need a little bit more time to go back to table and try to maybe work with staff and design what this evaluation process would be? And then if we're gonna move forward with hiring another legal counsel to help us through the evaluation, just look a little bit more of those details, or
Well, what we were looking for, the committee, our recommendation, what we as a group decided is that we were going to recommend an evaluation. So the first step of that, we're saying we want to bring it to the board to then vote on. The next step of that, if the board had voted to do that, was to then determine what was going to be the best way to do that so that the evaluations would be confidential, that we could go through that process and make sure that that was all done in the right way. And that's why in looking at options for that, we were looking at retaining outside counsel for that very limited purpose, so that that process would be confidential.
And one of the things, may I, because that was part of item 2, was that I did check with our current legal counsel because we weren't sure if we could do a group of the directors in a closed session to do an evaluation process. Because that's what we didn't know or understand. How do we maintain the the confidentiality of it. And it is understood that we can hold a closed session, that the board can, and what this is my thought at this point, and this is what the evaluation form that was being presented, if that was acceptable to the board, then we could provide the evaluation form to each of the directors, actually have a closed session where the directors can communicate between each other and create then kind of a finalized summary evaluation report then that could be shared with the legal counsel and determine if that's sufficient or if you ultimately would like to go out for an RFP. I think knowing that extra piece of information that we can do the closed session, that would be a recommended approach versus the external legal counsel, which we felt might be the most confidential at that point.
Any thoughts?
I'm fine with doing an evaluation.
Just confused when I saw the agenda because I thought that was what we had agreed on to bring, and then it'd be put on the agenda. So when I didn't see it on the agenda, I was a little bit confused.
We asked for it to be included, but not necessarily as an action because we didn't know if it was too early for it. And I was also hoping to see the actual evaluation form on the agenda.
And I think that's what was being recommended by the committee, was to bring the recommended form to the board for viewing. And then that's what was removed from the agenda, because it was bringing the form that you were recommending for the full board to see and then approve the form if you chose to do an evaluation. And then we were figuring out what the actual process or the logistics of the evaluation would be. So at this point, you haven't seen the form to prove. Could we send that out directly to them for their viewing, or how do we need to do
Yeah,
that?
no, I think that's fine. The form's similar to the board adopted in open session, the form that's been used for the CEO. And for all intents and purposes, because of confidentiality and privacy issues, evaluations are, general counsel's treated similar to an employee of the district. So, for your own, everybody's protection, that's the process we use. So that's the suggested process. I think the form was fine. I think it certainly, anything can be improved on, but I think it's certainly a good start.
Yes.
I think Director Hodgson has.
Go ahead, no, you go ahead.
But we did review the evaluation form at the meeting. We went through it, we asked questions, so that's the form that we did approve in it for a recommendation.
Yeah, I was gonna comment. Yeah, I think we did kind of go through the form, came up with a process. I think the part that we got hung up on was who was gonna collect this information, considering normally when we do these evaluations, they go to our current legal counsel's office who compiles all of that. I don't know if we've made a final determination if the head of the ad hoc committee was gonna compile those and produce the report, or if it's something we were gonna get.
I think either way, whether it goes to the chair or to the CEO, we can protect.
I would recommend that since we have the support here with somebody who is an attorney, that you're open to that, of just compiling that there, and
Sure.
you need help to do it.
Yeah, would that be allowable?
Yes.
Okay. Do you have any questions on that direction?
And would it make sense to have a closed session where you guys can interact, or are you wanting to have the individual forms completed and then?
I think we'll probably do it that way, because that's how I think all of us bringing in our separate comments and our observations and different times on the board and work experience, and then coming together much as we do the CEO evaluation in a closed session that we just discuss the results. I think that'll be based on the ad hoc committee chair over there when she wants to do that. But I think the evaluation form was pretty fair, pretty well done, pretty basic, but for the first time that we've really ever gone through evaluating our legal counsel, I think it was a very good start to the process.
Alrighty.
Do we need to make a motion to send that out?
It's not an action.
It's not an action item, right? So, okay.
Or just-
Consensus.
Thank
Okay,
you.
thank you.
Thank you for that report.
Thank you.
All right, so the next item is I. Right, legal. Mr. Scott?
So I'll confine my comments to closed session. That's it.
Thank you. J, committee meeting. J1, Finance, Legal, Administration, and Real Estate Committee. Mr. Director Luxton?
Sure. The draft meeting minutes are there to review. We updated you on the ad hoc committee. Thank you for that update. We spent a lot of time working on the budget. I think they did a really nice job preparing it. Eric and team did a nice job putting that together. So I think we have a pretty sound budget. We went through it with a fine tooth comb. It's a very nice setup. That is why I made the comments I said before, because I think this budget going into next year, we spent a lot of time, even more time looking into that. So if there's questions on the budget, we can address that. I think there's an update on the real estate. I received an email, Chris, about the property that we were looking at on Berkeley.
Yeah, that's no longer available.
Sounds like it's not available. So again, it's part of the process of, if we find something we like, I think we move quickly to get something under a general contract, not a purchase contract, but an LOI. That way we can finish our due diligence. So
I think that's the key is move quickly.
yeah.
I disagree, actually. I think that if it's gonna happen, we have to still do our work. We have to make sure that it's the right property or properties. And that if we end up getting it, great, and if we don't, then we just move on to the next one.
Yeah.
But I think what
Slightly push back.
being quick to it is to tie up with the LOIs so that we can
Okay.
take our time in getting,
That's great.
not to quickly buy it.
No quickly
Okay, thank
buy.
you for that
Just-
clarification.
I think we've processed now to a quick LOI process
Yeah.
where we can then get the time, because we didn't even have a chance to even evaluate the property.
Right.
It's gone before we get an LOI accepted.
That's what was disappointing. I just don't think we moved quickly enough to get into the LOIs so that we could do this.
Yeah, correct. That's all. If there's any questions, we can take them now.
Any public comment on this item?
No public comment.
Thank you. Next item is J2, Legislative Policy Committee. Draft meeting minutes. Summary on initiative. And then also on a legislative bill report. This are attached to the agenda. Are there any questions on them? Be happy to answer. Any public comments?
No public comment.
Thank you. Next item is J3, Program Committee, Director Perez.
We went over the draft meeting minutes, progress and financial report updates, and the grant application status report, and the grant payment schedule. All the information was located in the packet. If anyone has any questions.
Any public comment on this item?
No public comment.
All righty. So what we're gonna do is we're gonna pause our meeting and then move on to our foundation meeting. And then after we close that meeting, we're gonna come back to this meeting and go into closed session. Correct?
Yes.
Let's go ahead and do that.
We're gonna go directly into the foundation, or we take a break?
We can go directly to it.
That's no problem. Will we be doing board member comments at any point?
If you have any comments, you're welcome.
We can do it at the end, that way
We'll do it at the end. I just want
because there's a board
At the
member.
end
comment
of the
to
foundation?
either one is fine. It applies to both.
Okay, all right, then we'll go ahead and do it under the foundation.
Thank you.
All right.